Hi everyone, I'm just going to show you how to quickly do a care plan for a patient. So as you would know, there is a thing out there called a GP management plan, which allows you to I suppose have structured consultations with patients that have chronic medical conditions. So, as far as care planning is concerned, there are two elements to that. There's the GP management plan, which is really a statement of goals, objectives, and who's responsible for the different activities on the plan. And then there's a thing called a team care arrangement, which is the arrangement which allows you to then involve other health providers in order to improve people's health. Um, so with a care plan, really all people need is some sort of chronic medical problem. Whereas with the team care arrangement, it should be a chronic medical problem that requires team care. And a team is defined as 3 or more medical providers who all consent to um, looking after that patient or being involved in the care of that patient. I'm going to show you one method that isn't used throughout the whole practice altogether, but I certainly do use it, and a number of the other doctors do also. And it's called CDMNet. So CDMNet is an online service that integrates loosely with Medical Director to create care plans and also correspond with other health providers. Because one of the things about a team care arrangement is that it needs to have some mechanism for contacting the other providers, whether that's a manual mechanism or an automatic email type mechanism. So I'm just going to show you what to do. So you've got the patient here, and if you go down to the icon bar underneath through here, and then you look at the little ECG type little figure there, that opens up the CDMNet program. So not really sure what just happened there, but oh, okay, I fixed that up. So I've opened the test patient up again, and opened up the CDMNet connector. And then what I can do is I can either create a health record on the CDMNet server, which is based in the eastern states, or if they've already got a care plan, go to the health record. So let's create a health record. And what it does is upload some of the details about the patient to the web service, opens up a web browser, and then I can click on some of these, click on some of the consent type things. Okay. And then I can create a care plan for this person. So I can click on the create care plan button, and then it asks for consent. Click OK. And then I can ask for a GP management plan and a team care arrangement. And most of the time it'll be both. And it's already picked up on a number of the chronic medical conditions that the patient has had in the record. You can also add a custom condition so that it doesn't so that you can create different tasks that are sort of put into the same care plan. Click on continue. And then what it does is it just creates the care plan here. So it's automatically filled out some of the details about the objectives of the patient based on some of the medical conditions. It's used some of the providers that you have used in the past, so that it minimizes a bit of the choosing and clicking and all that sort of thing. So in terms of the main objective, it always includes these sorts of things, which are very vague and not really tailored towards a particular patient. But you can just click on them and you can just change whatever objective you're talking about. So you can sort of say, oh, this person's main objective is to have a fulfilling quality of life. So enjoy life, and I think the patient ought to be responsible for that one. You can work your way through the care plan. So, the different categories of understanding. You can see that, because there was a history of asthma, that there's a field here about asthma symptoms, asthma management plan, talking about contribution of emphysema, chronic bronchitis, etc. And then, coming down a bit, it'll probably include some of the things about diabetes. So, there's the managing the body weight. So because we put in some of the weights and heights, it automatically populated it with a target for the weight, which is semi-reasonable. Stopping smoking because the patient's a smoker, managing the alcohol consumption, etc. And you can really change these sorts of things, quite a bit. And then these are some of the diabetes type goals. So controlling the blood sugar, controlling monitoring HbA1c, checking the sugar, etc., etc. Checking for diabetic retinopathy, checking for diabetic foot, and other cardiovascular complications as well, etc., etc. You can see that it's populated it with, a podiatrist that we use locally, an optometrist that we use locally, pharmacists if there are a lot of medications. And what you do is you just change a lot of these sorts of things to customize it to your situation. And then when you are happy with it, you can approve the care plan, and then it'll automatically sign a referral form for any home medicines review if you're referred for one. You can ask it to create and distribute a team care arrangement, and click continue. And then you can allocate however many visits you want to allocate to the different allied health providers. So, you can say, oh, well, we can allocate 3 visits with the podiatrist, etc., and then approve it. So what happens after that is it then sends an email to people that are on record, and they will generally get back to you either by fax or by logging into the system directly and indicating their consent, typically by fax. And so what you can do then is you can go into the care team and you can indicate that such and such has agreed to help look after the patient, and you can just add agreement. And as soon as there are more than 2 people who are involved with this patient's care, that care plan then becomes eligible for billing a team care arrangement as well. So you can go back to the care plan and you can see that you can now approve the team care arrangement, and that's that. Now, a lot of this will be done for you by the chronic disease nurse, so that it's all streamlined to make your job a little bit easier. But if you have any problems or any concerns, don't hesitate to let me know.